of health advice this morning from Dr. Chant, and following conversations with both the Victorian Premier and the Prime Minister of Australia, Mr Morrison, that New South Wales and Victoria will be shutting down their borders from midnight tomorrow night. So today and tomorrow is the last time in which any Victorians will be allowed across the border unless they have a special permit or some exemption. We have done this based on health advice, and especially given the fact that when our nation had those higher number of cases back in February and March, the vast majority of those cases were from overseas travellers or their direct contacts. What is happening in Victoria is very different, which is why we've had to take this necessary step. We wouldn't have taken this step unless we absolutely had to. And in essence, it also takes pressure off Victorian resources because our police and our health officials are able to do their jobs on this side of the border and allow the Victorian officials, whether it's their health officials or their police, to focus on getting a control of the virus. I appreciate that the Victorian Premier has already spoken to the media today, and he would have outlined the fact the community spread is increasing throughout Melbourne. And we are also concerned, based on the health advice I received this morning, that there's no guarantee that some of people in regional Victoria may have not been seeded, what they call seeding, or we don't have any confirmation that nobody in regional Victoria is immune from the virus at this stage. Please know this isn't a decision we take lightly, but during the pandemic I've always said New South Wales will have a no regrets policy. And I thank both the Prime Minister and Mr Andrews for allowing us to move forward with this decision. And I also stress to the other states, now that New South Wales has taken this decision, and given where we are, there's really no excuse for any other state apart from Victoria to have any border closures with New South Wales. And I urge all the other states of Australia, in our national interest, to think about that. Given this move by the New South Wales government, we now anticipate that the rest of the nation will be able to deal with each other directly without any hard border closures. I will now ask the Health Minister to say a few words. Dr Chant will then give an update today which confirms again no community transmission in New South Wales, which is pleasing, but we are forever vigilant and forever mindful that what's going through Victoria can very much happen in New South Wales. And I also want to confirm and thank the New South Wales Police Force. Commissioner Fuller and I and relevant authorities have been in contact for a number of days now in anticipation that this could be occurring today, and I want to thank him for being so ready, because as you know there are around 55 border crossings between New South Wales and Victoria. It's a mammoth task. And the Commissioner will outline the action the police have already undertaken, and also consultation we've had with our federal authorities and the Victorian authorities as well. The Minister has